Hi, I'm Sunil Chilakuri. I get the pleasure of discussing today with you, Dr. Sarbaziha. We're going to be talking about your practice. She was selected as one of the top 5 to watch under the age of 50. You look much, much younger than that, so you're okay. But tell us, you're doing a lot of innovative work. You're doing a lot in wellness, double board certified. Tell me a little bit about your journey.
I started my residency in internal medicine. I did 3 years of that, and I ended up working as a hospitalist for a little bit, but I realized that during my time, I needed something more, and I wanted to do more for my patients. I wanted to really help them prevent disease, make them look better, feel better overall. So I did a fellowship in integrative medicine.
Wow.
And I was always good with procedures. I was the only internal medicine resident that did all the procedures, paracentesis,
Sure.
lumbar punctures, intubation, central lines,
Wow.
all the things that
You just like needles.
I loved it. That was what I thrived on. And so I started training in aesthetics, and it just made sense to me. And the world of integrative medicine is really what makes sense to me as well. So I brought the two together, and
Excellent.
the rest is history.
I love it. So tell me, a lot of times, especially in the last probably 6, 7, maybe even 10 years now, a lot's changed with integrative medicine.
Yes.
What have you learned in the last year that's changed maybe what our thinking was before?
Well, recently I've noticed that there's a lot of practices popping up that use the term integrative aesthetics.
Yeah. It's not.
And I love it because I realize that more people are understanding that in order to look good externally, it's really about what's going on the inside.
Mm-hmm.
And so I think over the past year, that's really blown up more and more. There are integrative medicine, the concept started originally at the University of Arizona,
Mm-hmm.
and that's where I did my fellowship. And now it's worldwide.
Yeah, it's made a big difference. Are you noticing for your own personal health that you're doing anything different than before you did your fellowship?
Yes, absolutely. As soon as I started doing my fellowship, I started ramping up the supplements
Okay.
that I'm on, lifestyle changes, really trying to practice what I preach. And that's what's important in this industry is that as the provider, you can do that.
Right.
You can practice what you preach. And so ensuring that I can represent what I'm trying to provide for my patients and
Definitely.
the community.
Yeah, no, makes a big difference. And so, again, from a selfish standpoint, yeah, I'm in my mid-50s, and I never took supplements up until COVID. And during COVID, what changed my life was we had an integrative specialist. She came to the practice. She wanted to learn about injectables. And I know her husband because we trained him a couple of times. He's an ER doc. He's excellent. And I asked her, I said, Dr. Davis, why are you here? You don't want to inject. You don't even like picking up a needle. She goes, no, I just want to see what can be done. Right. I said, okay, that's fine. So it gave us a kind of a guideline and a baseline to talk about something. And I was complaining that I had lower back pain. I'd had it for 12, 13 years. She goes, you know what? I can help you. And I said, listen, I know you guys, you're smart, but it's like voodoo medicine. I always describe it. I didn't know anything, right? I had no idea what the clues were. And so she starts talking about how from a cellular level, you can change what's going on. And she said, let me try something simple, just cut out gluten. She said, do that for 2 months and you tell me if your back pain goes away. It didn't go away. So she calls me up and she says, hey, how's it going? I said, well, it's about the same. Okay, I'm gonna send you something. So now I don't take any medicine, so I'm a little bit, I said, don't waste money, I'm happy to pay for it. So she put me on, I'll tell you what it's on. I'm on an orange pill, I'm on a yellow pill, I take 1 green pill and 2 white pills and a clear pill. And I don't know what the hell they are.
You don't know what they are?
I have a general idea. One's like a B...
B complex.
A B6, is it a B complex or B6 or something like that?
Okay.
I put one under my tongue now. She just changed it up. I've got that B12 sublingual. She told me to take magnesium at night now.
Magnesium's everything.
Really?
Everything.
So tell me, these things that I'm taking, I don't know what they're working though, because my back pain is gone.
Yes.
I feel, and I'm not taking any testosterone, I'm not doing anything different. I can tell the difference in the gym as well, and within clothes for sure. So what would you advise for yourself? What are you taking? What's on your countertop?
What I take myself, and when I talk to my patients, it's an individualized approach.
Sure.
So what I take doesn't necessarily mean what you should take. I love magnesium.
Okay.
So that's actually the one supplement that I think almost everybody can take without any harmful consequences because most of us are deficient.
Okay.
And it has a lot to do with the food we eat and the soil because it's like overused and the magnesium is just not in there.
Okay.
So I love magnesium. I take it at night. I even take it during the day.
Oh, okay.
Vitamin D is really important, but checking your levels is super, super important.
Okay.
What else do I take? I recently started taking berberine. Do you know what that is?
I do.
Yes.
So tell us a little bit about berberine. I just learned about this 3 weeks ago. I was at a conference where the speaker is a wellness doctor. She's actually a dermatologist, and she did a fellowship in integrative medicine.
Nice.
Brilliant. And so she's telling me all these names. I never even heard them, so I'm taking all these screenshots.
Yes.
So tell me a little bit more.
Berberine is a plant.
Okay.
And the way I take it is in a concentrated form in a pill. But berberine is found in several different plants.
Okay.
But I'm not sure if you're familiar with Persian dishes, but there's a famous Persian dish it's like a rice dish with these little berries on top. Have you seen that? That's berberine.
Okay.
That has berberine in it.
Okay.
And basically what that ingredient can do for you, there's multiple things, and these are all backed up by scientific studies. It's not just someone just thinking that it does that.
Voodoo medicine.
Yes. Studies have shown that it can help lower cholesterol levels.
Okay.
It can restore the gut microbiota, and it can also help curb your appetite.
Wow.
So if in the media these days, berberine has been called nature's Ozempic.
Okay.
It's a great way to really help curb your appetite and keep you overall feeling great.
Excellent. How about this metformin? Some people are saying that you take 500 milligrams metformin even if you don't have insulin-resistant diabetes.
I'm more about doing more of the natural because I know there's side effects even with supplements, but I would say more so if you're taking pharmaceuticals. I do prescribe pharmaceuticals, but overall I'm not really on the whole metformin bandwagon. I mean, I know there's studies that support the use of it, but I also have other options for my patients.
Perfect, and that's great to know. So let me ask you about, now we're talking about Ozempic and there's Wegovy.
Yes.
So are you seeing that shifted your practice?
Big time, big time. I do a lot of peptides, so semaglutide is the generic name, and I usually get mine from compounded pharmacies because the ones from like the traditional pharmacies are more expensive for the patient and more difficult to obtain. So I've been offering a lot of tirzepatide, semaglutide, but other peptides as well. And it definitely has transformed the practice. People are interested in weight loss, and sometimes with weight loss, you need an extra push. It's, and it's okay to do that. Okay.
How about for thinner people like you, like myself? Some of the studies that I read show that there's a cardiovascular improvement with the semaglutide as well as the tirzepatide. And also there's an improvement in mentation, right?
Yes. It can actually help improving, it helps protect the liver, protects the heart, it can protect the brain. It can also, sorry, I lost my train of thought, but cravings, that's really important. So sugar cravings, alcohol, drugs, I mean, there's obviously more studies that need to be done, but there are studies that show that it can help with certain cravings.
Excellent. So are you noticing, would you still prescribe it to somebody who's on the thinner side, more for the liver benefit, the heart benefit, the brain benefit?
If someone, well, it really depends on the person. There are other peptides on the market too that I might choose if the person is a little bit thinner and I don't want them to lose weight. So it really depends, but I have prescribed these medications to people that aren't considered morbidly obese or overweight, but they want to lose maybe like 10 to 15 pounds, but I watch them extremely closely and I check their labs. You titrate up, you don't start at a high dose. So as long as the doctor is constantly monitoring you, then it should be pretty safe.
Well, I think it's important, like the good doctor, she talked about what labs, we have to monitor certain labs. And we had a local doc talking about that there can be an increased risk of pancreatitis. People are starting at way high doses, and it's really about the monitoring and make sure that they're doing well. Would you recommend to the audience, would you recommend that they perform a fellowship with integrative wellness?
I think every practicing physician should have some sort of integrative background, not doing the fellowship, but there's a lot of courses online that you can get CME credits for.
Excellent.
Either they're free,
Okay.
and I can give you the resources for that later. Either they're free or they're really inexpensive, like less than $100 or maybe $100, and just to kind of open your mind a little.
Excellent.
And learn, what is out there.
Sure. Well, and I think also with AMS, that's one of the goals, is to really do this global educational platform so we can learn from Dr. Rahi and learn from others about what we can do. And so I'll ask, if you don't mind, I'll ask the AMS organizers to just get some of those links if there's anything that they can learn from you.
Yes.
As we close out, I have a question for you. What would you change for 2024 based on what you've done over the last 4, 5, 6 years?
Well, recently I moved offices, so I'm really excited about that. I moved October of last year, so I think 2024 is already a different year.
Excellent.
So just more focus. I guess historically I've, been someone that's been all over the place. I used to like hop around to different states and practice in different states.
Oh, wow.
So I think now it's time for me to just focus and really perfect what I've been creating over the past, honestly, it's been over 10 years now.
Wow, excellent. That's fantastic. And what made you change offices? Was it an office location or size, or what's the difference?
Yeah, I basically outgrew my space. It was just, if you saw my other space, I just outgrew it. And the lease was up, and so now I got a storefront, which I think is perfect for what I'm practicing. It's like a visual practice, so it's nice to have a visual storefront.
Good. And for those who are watching, a lot of people are just getting started. What size square footage did you have before, and what have you grown into?
Oh, I'm in Beverly Hills,
Right.
and so the square footage is extremely expensive. If I tell you my rent, you might have a heart attack. So I won't do that. But actually, my square footage is still around 1,000.
Perfect.
And when I started part-time because I was transitioning my career and, still educating myself. So I actually started in a room that was tinier than this stage.
Perfect. And I think that's important to learn, because a lot of times people see you're on the podium, they're like, oh my God, I'm never going to gain that success. It just takes steps.
Yes.
And, we started with 2 rooms. I started with 2 rooms that I was subletting from a physician. Each room was 110 square feet. And then I was like, okay, can I rent one more room? And so then we had 400 square feet. So you don't need a lot of space.
You don't.
It's just planning it out. And I'm glad that you said your space is quote unquote small. 1,000 square feet, you can do a lot.
You can do so much. I actually have 5 treatment rooms in that 1,000 square feet. So I was able to really create, because I built it out.
Good.
So with aesthetics and even integrative medicine, you don't need
massive
the size
space.
of an operating room. You just need tiny rooms where you can, do your procedures or even do your consults.
Sure. I love that.
So, yeah.
See, it makes sense. So again, we're all going to we're aspiring to be as successful as you are. Thank you for joining me. I appreciate it. And again, any audience questions at all that you have for Dr. Rahi? No? Well, thank you for joining us. I appreciate it. Thank you.